My name is Dr. R. Stewart Fowler. I was trained in medical school at University of Utah. Then I did my residency at Mayo Clinic Rochester in obstetrics gynecology. I was in private practice for a couple of years. Then I got invited back to Mayo Clinic Arizona. And from that time forth, I became the hormone expert at Mayo. Hormones became popular in the early 80s in the United States. And by that time, we had discovered that if we gave estrogen alone, which was the initial approach in the 60s, it caused women to get uterine cancer, until we discovered that by adding progestin into the mix, that totally negated that risk. Then came the question that there was a hormone in women called testosterone. The general public always thought that was the male hormone, and women didn't need testosterone. For years, we had one type of testosterone in an estrogen called estratest, and it was approved by the FDA for women that had refractory hot flushes and night sweats, meaning didn't have full relief of their hot flushes and night sweats on estrogen alone. They could be on estrogen plus testosterone, called estratest, and it has worked very well over the years. But then further data came out, particularly regarding different forms of testosterone. And almost all forms of testosterone cause a trough, then a peak. And that's true of oral testosterone put on in the form of gels or creams, or testosterone put sublingually. And it turns out that the testosterone receptors do not respond well to seeing that peak and trough. And then we noticed a marked difference in response of women using pellet therapy to get their testosterone. And what pellet therapy does is place under the skin so that the more active a person is, meaning the faster their heart is beating, the more testosterone they get. And that was found to be a key determinant in getting the testosterone receptors to turn on in women. So by giving it that way, we found out, in comparison just to estrogen alone therapy, that women had a tremendous response in regard to their sense of well-being. Mainly because testosterone receptors are abundant. And when you're on testosterone, you get invigorated. You no longer have need for afternoon naps. You recover faster from exercise. And the second thing that women feel is that the testosterone stimulates their genital tissues so that it's easier for them to reach orgasm and have stronger orgasms. The third benefit we found is the testosterone stimulation in the frontal, temporal, and parietal lobes of the brain, where women got an increased sex drive. But not only that, they got increase in their focus, concentration, and memory. When women are in their menopausal ages, they would get a mixture of anxiety and depression symptoms, and those symptoms would work out. In fact, it's found to be so obvious that it works so well that psychiatrists in our area in Phoenix, who are very aware of pellet therapy with testosterone, are now referring patients here if they have simple anxiety or depression tendencies. The vast majority of those women get relief of those symptoms, so it causes a mood evenization. So a lot of women knew about the sex drive, but a lot of women didn't know about the energy level and the cognitive effect. So women will come in and say all the time, well, the sex drive is great, but the concentration and mental acuity is wonderful. So I consider it the best kept secret in women's healthcare.